What causes ovarian cysts? Polycystic ovary syndrome, also known as PCOS, is an endocrine disorder that alters hormone levels, excess androgens, preventing ovulation, which causes the ovaries to enlarge and cysts to form. But what exactly contributes to the development of PCOS? Do all women with PCOS experience the same symptoms? What causes ovarian cysts? The cysts do not cause the syndrome. They are a symptom of the hormonal and metabolic imbalance occurring in the body. They are undeveloped egg follicles that were not released during ovulation, remaining trapped in the ovary and appearing as cysts. We have already discussed the symptoms of polycystic ovary syndrome on this site. The syndrome is diagnosed through a blood test to check androgen levels. By lowering androgen levels, a woman may begin to ovulate again. The key is to treat what is causing the increase in these androgens. The cause is uncertain and can vary from person to person. It is often related to genetics, but also depends on environmental factors. By removing these environmental triggers, symptoms can be reversed. That's why it's important to identify what factors are affecting you. The main causes are listed below. Insulin resistance. Most women with PCOS have insulin resistance and produce high levels of insulin to compensate. These high levels of insulin stimulate the ovaries to produce more androgens. However, not all women with high insulin develop PCOS. That's where genetics comes in. For those who don't know, insulin is a storage hormone produced by the pancreas to metabolize blood sugar and produce energy. When we eat, the body detects a rise in blood sugar, glucose. If glucose levels remain high for too long, it can damage brain, pancreas, heart, liver, and eye cells. To prevent this, the body stores the excess sugar in muscle and liver cells for later use. This storage is made possible by insulin. It acts like a key that unlocks cells to let the glucose in. When insulin is overused or chronic inflammation occurs, the insulin can no longer unlock the cells, and glucose builds up in the blood. This is insulin resistance. Insulin resistance is one of the main contributors to polycystic ovary syndrome. And one of the causes of insulin resistance is inflammation, a defense mechanism of the body when the immune system is chronically activated. Therefore, to treat PCOS, inflammation must also be addressed. PCOS after taking birth control pills. Some women develop the syndrome after using birth control pills. These contraceptives interrupt the communication between the brain and the ovaries, stopping ovulation. When a woman stops taking them, ovulation usually returns along with menstruation. But in some women, this doesn't happen. In such cases, PCOS is not due to androgens, but rather an imbalance in the LH and FSH hormones, which are responsible for ovulation. If you never had PCOS symptoms before taking the pill and started having them afterward, it's likely the syndrome was triggered by the pill. Stress and obesity. Chronic stress and obesity can also contribute to the development of PCOS. In the case of chronic stress, the brain stimulates the adrenal gland to produce adrenaline and cortisol. At the same time, it produces androgens, which are responsible for PCOS. Additionally, stress encourages inflammation in the body, which can lead to insulin resistance. In obesity, the person is already in a state of chronic inflammation, which can lead to various problems, including insulin resistance, directly linked to PCOS. Conclusion about ovarian cysts. As we can see, polycystic ovary syndrome can be caused by several different underlying issues. There is no cure for PCOS, but its symptoms can be treated. In cases of obesity, losing weight and adopting a balanced diet can help reduce symptoms. There are medications to treat symptoms such as excess hair growth, irregular menstruation, and fertility problems. Smoking and alcohol cause inflammation in the body, so they should also be avoided.